Hello, everyone. My name is Margaret Spratlin, and I'm the outreach specialist here at Longstreet Clinic. We are mighty proud of the almost 200 providers we have at Longstreet and are excited to introduce you to 4 of our newest physicians today. They all joined our clinic this summer. Dr. Kelly Odell, if you'd give a wave. Dr. Yamin Sun, give us a wave. Dr. Courtney Grant and Dr. Kevin Waits. We feel fortunate to have these incredible physicians now on our team, and we wanted to take a few minutes to allow you to get to know them a little bit. Dr. Waits, I'm going to start with you. Can you tell us a little bit about your background and your specialty? All right, Dr. Waits, I'm having trouble here. Okay, there we go. Can you start over for us? Sorry, we had a little technical difficulty.
Yes. So I grew up here in Georgia, originally just north of Macon, Georgia, where I went undergrad and medical school at Mercer University, and went up to VCU in Richmond, Virginia for residency, and now back here to serve Georgia in the medical community.
That's great. Did you always know you wanted to be a doctor, or what did you want to be when you were a young fella?
Well, earlier on in high school, I thought I wanted to go into engineer to solve some complex problems, but actually went through a AP biology class and learned I could do that with serving people and helping people in the healthcare industry and the field. So I tunneled all that towards the medical field and got involved in neurosurgery early on.
That sounds good. Dr. Grant, how about you? Same question, a little bit about your background and why you chose it.
All right. Well, I'm also a surgeon like Dr. Waits, so we have very similar backgrounds with what inspired us to become what we are. So, you know, I always say that becoming a doctor for me seemed more like a calling. So I'm sure Dr. Waits probably has these stories from family as well, but I was always that child that, you know, always want to be the first to have an answer to a problem, to fix something. I would take things apart to try to figure out how they work, to put them back together again, which may have got me in trouble a few times. So I think no one in my family was surprised that I became a surgeon. But yep, like Dr. Waits said, you know, becoming a doctor and using those natural skills and that curiosity and knowledge to be able to help someone feel better. There was no other career that really could do that for me. So becoming a doctor was kind of the fit for me.
Good, good. And Dr. Grant is a vascular surgeon, so we'll hear a little bit more of that as we go forward. Dr. Odell, kind of the same question. Can you tell us a little bit about your training and your specialty?
Yeah, so I'm originally from the Midwest, so I did all my training in Indiana. I went to Indiana University for medical school, and then I did my residency in Indianapolis at St. Vincent Hospital in family medicine. So doing primary care now in Oakwood. I knew I wanted to be a doctor, you know, all the way back to like early high school, just because I really enjoyed, you know, science and learning about biology and how the human body works. But also I developed a really good relationship with my primary care doctor, and I wanted to do that same thing for other people. So it was a pretty easy answer to a calling for myself as well. And I always wanted to do primary care. I wouldn't want to do anything else.
That sounds great. And I know you're building your practice in Oakwood. Is there any one thing that you would like your potential new patients to know about you as a family medicine doctor?
I just want them to know that, you know, I'm seeing all patients. So I enjoy seeing children as well as, you know, all the way up to, you know, 100, 102, you know, I like to see the whole family. And so I'm welcoming everyone. And I think it's really beneficial to have the whole family involved with the same doctor. It gives a unique perspective. And I think that helps me treat my patients better, kind of knowing where they come from and their family history. I think that makes a big difference. So I just would like to develop those long-term relationships with the families in this area.
And do you take all ages? Is there an age too young, or what's your range span?
All ages. There's no restrictions.
Got it. Very good. Okay, Dr. Sun, a little bit about yourself and your background.
All right, so I'm from Texas. So I went to medical school at University of Texas Medical Branch. I did my residency at Baylor College of Medicine in Houston, and finished my hematology and medical oncology fellowship in Baltimore at University of Maryland. So just moved to Georgia. Very excited to be here. Yeah.
And what made you, how did you decide on your specialty, which is oncology and hematology?
Yeah, so most of what I treat is cancer patients. So I feel cancer is just a very special disease that can, profoundly impact patient, their families, for a long time. Even patients are, finished their cancer treatment, there are still things that need to be sorted out afterwards. And there are a lot of exciting research that's, with new drugs, new treatment that's coming every, week or month. And I think it's just a very exciting field, and it's very rewarding to be able to help patients, live longer and, enjoy their life. Yeah.
That sounds good. So all of you have joined this field for great reasons, and it's nice to know we have this compassion that you all have as a background for the work that you do. Back to Dr. Waits, you've been here for what, 3 weeks? I know you hit the ground running with a full patient load. What do you like the best about working with Longstreet so far? And this is neurosurgery, if you didn't mention his specialty so far.
They really helped me hit the ground running early on when I was trying to learn the medical record system, learn the hospital, and that's really helped me focus on my patients to just try to start seeing people and get things moving along.
That's good. Would you say that you have any particular goal for your first year at Longstreet?
Yeah, actually that is to, learn the health system and to become efficient at navigating it so I can really focus on my patients and caring for them.
Good. Well, you've jumped in full force, so I bet you're already smoothing things out. Moving along to Dr. Grant, what is your favorite part of your workday in the vascular surgery world?
All right. So my favorite part of the day is getting, I think, to see my patients, both in the hospital and in the clinic, after we've been able to do a successful procedure, and to see them have the smiles on their faces when they have the relief that we're able to offer with our procedures. I did not say earlier that a vascular surgeon, what we do is we solve the problems that affect the arteries and the veins in the body. And so whether that's from a blockage to an aneurysm or anything that affects the circulation to the body, we can fix those things. And a lot of times when we're able to fix them, our patients can feel pretty quick relief from them. And that's one of the reasons that I really like vascular surgery as well. We can definitely help people feel better pretty quickly.
That sounds good. That's great. Anything in particular that was a draw for you to come to Northeast Georgia, to this area?
Absolutely. So I grew up in Georgia. I grew up in Augusta, Georgia, down in Evans, and I'm also a Georgia Bulldog. So I apologize to any Tech fans that are watching, and I have no apologies for any Alabama fans.
There you go. That's good.
But it really was a really good fit. When I came to Northeast Georgia and to Longstreet, everyone that I met felt like a longtime friend, and it just feels like I'm at home. And I just can't wait to become a part of the community and serve everyone here.
That sounds great. Really appreciate. Glad that it's been a good fit, at least so far. It sounds wonderful. Dr. Adele, tell us a little bit more about your family, especially your recent addition.
So I'm married and I have 2 children. I just had a baby in March, so she just turned 5 months old, and I also have a 2.5-year-old at home. So they keep me really busy. But it's been a big blessing to be able to spend more time with them. With all of us being stuck at home, at least I'm getting to spend time with my little ones and see them grow, and that's been really wonderful. We recently moved here from the Midwest because my husband, he got a position at Georgia College. So it's kind of how we landed here.
That sounds good. What was, was Northeast Georgia a good draw for you too?
Yeah, I really like it so far. The weather's a lot nicer here than it is in Northern Indiana, especially in the winter. So I appreciate that.
That's good. Great. Okay, Dr. Stein, I think you listed among your interests traveling, especially to some of our national parks. What are some of your favorites, and do you have one that you are looking forward to visiting the most?
Oh, I'm sorry. I think you got broken up a little bit. Can you repeat the questions again?
Yes. I think you had listed that you are really interested in traveling, in particular to some of our national parks. And we were just wondering, did you have a favorite out there, or do you have one in particular that you're hoping to go to as soon as you can get out from COVID?
Yeah, so the one that I've been to so far, my favorite, it would definitely be the Olympic National Park. So when I went there, I basically would just stroll from Seattle, and sort of it's like a circle, and you just kind of drive around the national park, and you can kind of stop and then go on a trail or go see the lake, and it's really beautiful. I would say after this COVID is over, the national park I would definitely be visiting will be the Yellowstone National Park that I've been wanting to go there for a long time. And I was actually going to go early this year, but it just, because COVID, I didn't get to go. So that would definitely be the first thing I would go. Yeah.
That's great. That's great. And speaking of moving around a little bit, I think you've discovered one of our favorite spots up I-985, Farmers Market. Tell us about that.
Yeah, so well, I know Georgia is very famous for its peach. Actually, I just got my car license plate changed today, and I chose the one that was out a lot of peaches. So the first thing I was looking up online was, after I moved, it was like, where do I get really good Georgia peaches? So Jaymore Farm was the one that popped up, and that was the first place I went to after I picked up my household ID in Gainesville. So I just went straight there, and they're really good. Yeah.
That's good. That's good. All right, moving on to some not so professional questions. Dr. Waits, can you tell us what your favorite thing to do is when you're not working? We got our.
But also,
Can you start that over? We had a little delay and didn't hear the beginning of yours, and I don't want to miss it.
hear me now?
Yes.
Okay. Well, recently it's been working on the house and just working on our property that we came here to. And other thing I like to do is spend time out on the lake, though it's been less time lately, getting busy with the practice and everything. But I look forward to doing that when I get a little bit more time down the road and get things more settled.
That sounds good. That sounds good. And if you were, this is a really random question, but if you were to have your earbuds in and you were listening to something of your favorite, would you be listening to music or a podcast? What's your go-to?
It would be music, definitely. I listen to all types of music, so it just depends on the mood and the day.
That sounds good. That sounds good. Do you listen to music when you're in your neurosurgery cases?
Oh yeah, definitely.
What do you have a favorite go-to when you're in surgery?
Well, it really just depends on what the staff want too. You know, it's a team effort in the OR, so one that everybody really enjoys and can, you know, even if it's a long day in surgery, everybody is looking forward to coming to the OR and working on and taking care of the patient.
That sounds good. That sounds good. Okay, Dr. Grant, I know you are a great cook and a bit of a foodie. What do you like to cook? What's your go-to?
And wow, foodie. So, well, I guess this will expose my Southern roots here. Okay. So there's absolutely nothing fancy about this, but a good macaroni and cheese.
Yes,
You
yes.
can make
A
it
lot
as
of fans of mac and cheese.
simple. You can make it as simple as you want, multiple cheeses. You can add crab meat. There is so many different ways to make that good, and everybody always enjoys a good mac and cheese. So
Yeah, that sounds good. That sounds good. So I'm assuming you don't pour yours out of a box like I've been known to do.
no.
Yeah, yeah, we're talking fresh mac and cheese. Also, for you, if COVID were over or when it's over, do you have a place that you would like to travel?
All right. Well, you know, in light of COVID, man, I think everyone's really missing family. So I would hop on a plane and head to Pennsylvania to see my sister and my nieces and just be able to hug them again. It's just been too long.
Very
But if,
good.
you know, I guess if COVID were not in the picture, like Dr. Sun had a trip planned this year, I would have gone to Marrakesh in Morocco. And so just have to postpone that to a better time. But I'm a culture junkie, so I really love traveling.
That's good. That's good. I hope you can get back out there very soon. Dr. Odell, speaking of food, would you rather cook or order in? You've got a busy family there at home. So what's your go-to?
I think probably before the kids, I would have enjoyed cooking more, but you know, with being busy with them, probably ordering in is a little bit more appealing. Uh, we've discovered a few restaurants that we like in the area, but we're still kind of exploring. But I think my favorite so far is Rico's World Kitchen in Buford. I really like what they have to offer so far.
Good plug for them. And if you could travel anywhere in the world and COVID was not a factor, where would you go?
Probably Italy. I think it would be fun to, you know, go and try the food there, obviously, get some good pasta and pizza, but also, you know, visit like Tuscany and, you know, see the vineyards there and, you know, visit all the cultural sites in like Rome. That would be cool.
That's good. And back to the music question, are you a symphony goer or a concert goer or more of listening at home?
Probably more listening at home these days, but if I had to choose between the symphony and going to a concert, I would definitely go to a concert.
Got it. Very good. And Dr. Sun, I know you spent most of your life in Houston, so you're used to the heat that we have here. What is your favorite season?
Oh, sorry. Okay, so I think I got dropped for a few minutes. Were you asking me?
I was saying, I know you have come from a nice hot community, most of your growing up in Houston, and so you're quite used to the heat here. Does that have any bearing on your choice? Do you like warm weather, or what's your favorite season?
Well, I would say my favorite season will be the spring. It's like basically everything comes back to life. And it's not super hot like the summer. I mean, I do like warmer weather, but I think I do like 4 seasons as well, that, you know, you can do things differently and, you know, different plants, flowers that you can see at different seasons. So, yeah.
Very good. And are you an at-home cook or a go out to eat person?
So it's probably half and half. Right now, it's probably more go out to eat a little bit. Well, more like picking up from the restaurant and eat. But I did cook a lot while I was not busy. So now I just kind of getting, moved in and things, adjusted. So I haven't been cooking that much, but I think once everything is settled, I'll start to cook more.
Have a little bit more. Okay, good. And I know your specialty is hematology and oncology. Can you tell our listeners the difference between those two?
Yeah, so hematology is basically, the study of blood disorders. So that can include things from benign blood disorder like anemia, low platelet count, high white blood cell count. But sometimes those conditions may be malignant, meaning it can be because of form of blood cancer. So that will be malignant hematology. Like leukemia or lymphoma. And medical oncology, my field is basically, treating any form of cancer that includes the blood cancers as well as what we call the solid tumors like lung cancer, breast cancer, head and neck cancers, things like that. Yeah.
Got it. So you treat all of the above. Dr. Waits, for neurosurgery being your specialty, can you tell them, I know it's brain and spine, can you tell our listeners a little bit more about the field of neurosurgery and the typical types of procedures that you perform?
Yeah, so neurosurgery, like you said, covers brain and spine. It also covers peripheral nerve. So we treat things ranging from brain tumors to degenerative spine disease, nerve compressions, whether it's within the spine or of the body more peripherally. I've did a fellowship in spine, so I have a specialty in that, but also we'll deal with the traumas that come in, whether it be brain or spine injuries related to trauma, and as well as tumors that as well. So I think here at Longstreet, we can deal with it all, but we all have our specialties to focus on each thing.
That sounds good. And Dr. Grant, for vascular surgery, I know there's a big difference between some cosmetic type sclerotherapy procedures and abdominal aneurysms. Can you give our listeners a little bit of a feel for vascular surgery and the gamut that you run?
Right, it is a very large gamut. So we specialize again in all of the arteries and the veins in the body. And that includes vessels that are feeding the brain, vessels in the arms, vessels in the legs, as well as in the abdomen. And so when there are blockages in these structures, we can help to fix them to open up circulation again. When the walls weaken and aneurysms form, we can help to treat those before they become a life-threatening problem and rupture. And then away from the very serious things, we also do things to help people feel better and help treat varicose veins as well. And one of the things that I love about vascular surgery is we can do all of these things not only through traditional open surgery with big incisions, but we have really cool technology to do things in a minimally invasive way. So we can help solve these problems in the operating room and also just by coming to our office and being able to help patients that way.
Do you do any procedures in your office?
Yes, and so all of those procedures that can use those minimally invasive techniques, people can come into the office for us to do. Examples of those would be people who are dealing with varicose veins. We can help to ablate those and get rid of that problem. Also, if there are blockages in the vessels in the legs, we can help to open those up in the office as well. And for patients who have dialysis access and we need to help to troubleshoot those, we can do that in our office. And then also for patients who need access for chemotherapy, so some of our patients will overlap with Dr. Sun. We are able to actually place those ports and accesses in the office to avoid a hospital visit for patients.
Very good, very good. And then Dr. Odell, I know as a primary care physician, a lot of folks don't quite understand the difference between a family medicine doctor and an internal medicine doctor, both considered primary care. Could you explain that for us?
Sure, not a problem. So the training is a little different because family medicine doctors are trained to treat children, as well as we have more training in OBGYN. So during my residency, I delivered babies and, did gynecologic procedures, more so than you would do potentially with an internal medicine residency. So it's a little bit broader in that respect. But the main difference, for the patient is that, I can see your children, I can see your mom and dad, and I can also, take care of your pap and all that stuff. So there's a lot of stuff that we can do to help you and your family.
All around care. Well, that's great. I'm actually going to ask each of our docs if they have anything to add. But first of all, that was a lot of fun. Thank you all for joining us, taking time to be here and learn a little bit. Thank you to our providers for taking the time to tell us a little bit about your story. You will all be an incredible asset to our team and our community and our patients. To those watching, I hope you get to meet these great folks at some point. If you see them out and about, make sure you give a socially distanced welcome. And if you're interested in getting to know any more about these providers, on our website, we have a welcome article for each one of them, and that's longstreet.com. If you ever have any questions for any of us, you can shoot us messages, or our main number is 770-718-1122. That's 770-718-1122. And so I'm going to jump back to our doctors to see if they have anything last minute to add. Dr. Waits?
Yeah, just looking forward to serving the community.
That sounds great. And Dr. Sun?
Yeah, same here. I'm very excited to be working with everyone in Gainesville.
Good. And Dr. Odell?
I think that's it. I'm just excited to grow my practice here in Oakwood.
Good. Anything for you, Dr. Grant?
I think everyone pretty much summed it up pretty well. We're all anxious to get started and help out up in Gainesville and serve the area. So thank you all for tuning in and allowing us to introduce ourselves to you.
Good deal. So to all of you out there, please like, comment, and share this video. And don't forget to keep wearing your mask and social distancing. Thank you for joining. Facebook Live for Longstreet signing out.
Bye.
Bye.